folks. Welcome to the next edition of our Vironix Expert Series. Today we have a fantastic, guest with us. I'd like to introduce him formally. Mahesh Visvanathan, welcome. A little bit about Mahesh's background. He's a customer-focused senior executive with rich experience managing operations and transformations for healthcare technology-based services. He has a proven track record of building high-performance teams to create value and deliver profitable results, and has championed the use of intelligent automation and cognitive analytics to solve problems, drive simplification, and jumpstart key growth initiatives. He served in leadership roles at Fortune 100 companies, including Thomson Reuters, as well as niche healthcare analytics players such as Struven Health, which is now part of IBM's Watson Health. Mahesh has a master's in business from the University of Michigan. He's a proud alum of the University of Michigan and an undergraduate degree in technology and science from Pits Pilani in India. Mahesh is currently at Vironix, which, as you know, is a healthcare startup focused on bringing smart AI-led solutions to help with early diagnosis, triage, and improvement of chronic health conditions. Wow, that's quite an impressive background, Mahesh. Welcome to the Vironix team.
Thank you, Sri. Really happy to be here.
Fantastic. So Mahesh, I do have some great questions, to ask you, and I look forward to this dialogue. Why don't we start by you telling us a little bit about your background and kind of, what sparked your interest in healthcare?
Absolutely. Really happy to. So Sri, I began my career exactly 30 years ago, computer programming on mainframe systems, and I quickly realized that I loved solving problems using software. However, my interest in healthcare technology was rather serendipitous and driven really by a need to learn new things all the time. So I was looking to work on something called RS6000 AIX systems, and I found an opening for a programming lead role at a very small healthcare technology company called MedStat in Ann Arbor, Michigan. I ended up staying there for 20 years, over 20 years, in fact. And what fascinated me and kept me in healthcare technology, Sri, was the clear value we were generating for clients, payers, providers, and the government in solving issues both in the business and in the practice of healthcare. It felt really good to work with a purpose that was connected with making people's lives better. That's how I came into this space and have remained here ever since.
Fantastic. Mahesh, a lot of old memories that you jogged, when you spoke about these RS6000 machines and this computing set, clearly a lot of good memories from IBM's pioneering technology.
Yep, absolutely.
Mahesh, a little bit about Vironix in terms of why you think insurance companies would be interested in the types of solutions that Vironix specializes in. Mm-hmm. What do you think the drivers for that type of interest is?
Great question. So in all my years of implementing high-end analytics decision support solutions for payers, we strived relentlessly to help our clients manage issues of ever-rising healthcare costs, which consistently, as you know, outpaces inflation and wage growth. But here's the thing, we were always sort of playing catch up. In fact, the whole payer industry, I'll say, is playing catch up even today. Since the information about cost and use, especially unnecessary and avoidable use of high cost services such as emergency room services and prescription drugs, almost always was after the damage was done. In other words, after the encounter took place at a healthcare setting, at a doctor's office, after high bills were paid, and in many cases after families experienced personal bankruptcies. So, that was the situation we are always dealing with in all of my years of service there. In a sense, I think the presence of a predictive, proactive, preventative, and let me add personal approaches in the payer industry was lacking. But times are changing, right? We are seeing health plans, big and small, realize that they need to not only do more, but they need to be more for their members. In fact, I'd say let's replace the word members and say consumers.
Wow. Wow, that's fascinating, Mahesh. I think that really shed some insight on that. And I think to me the most interesting thing you said was that there's a shift away from reacting to things,
Correct.
towards preventing, things from happening, right? So I think
Yeah.
that's a huge paradigm shift, and I think that's a great
Yeah.
great point. Yeah,
That's a big pivot around personalization, right? All of these payers, insurers are saying, okay, we have the advent of high touch personalized experiences we all experience in our everyday lives today. Think of the Amazons of the world, right?
yeah,
So with advances in AI and machine learning, things that Vironix is really close to and at the heart of their solutions, payers are increasingly interested in adopting these technologies in their space because they want to keep the member at the center of everything they do. And if they did that, and if they can do it quickly, then they can deliver value fast. Time
yeah.
to value is critical today. And that's where I think the Vironix solution is at the sweet spot of combining AI smarts with healthcare smarts that can offer a sort of personal care and do it quickly because of all of that API driven approaches, right? So you can easily integrate into an existing payer's product platform.
Fantastic, fantastic. Thank you, Mahesh. That was definitely very insightful. How,
Welcome.
of course, how does Veronix benefit employers? And how do you anticipate a change in future employer spending in terms of their priorities with regard to wellness as well as viral prevention?
Sure. It's all connected, really. What I just talked about for payers really
Yeah,
extends to employers too, right?
yeah, yeah,
Early detection,
yeah,
proactive and continuous remote monitoring that empowers individuals to take better charge of their health, that's going to make employees happier. And if you're happier, you're going to be more engaged. If you're more
yeah,
engaged, you're going to be more productive. I
yeah,
mean, all of those things are really a virtuous cycle that employers want to encourage today,
yeah, yeah,
right? And especially if you think about this aging populations, right? And with advances in healthcare treatment options, a lot of these options are expensive, needless to say. We are seeing more and more employees that are burdened with not only caring for their young ones, but also taking care of the elderly,
yeah.
right? So what happens then? It's putting a lot of pressure and causing stress and anxiety, which actually takes away from being fully engaged at work. So what are the employers wanting to do? They're saying, okay, hey, we all know the US healthcare spend of $3.6 trillion
Wow,
is so enormous. But think about this. Almost a third of that expense is borne by private insurance, which is largely employer sponsored.
wow.
So it is no surprise then that rising healthcare costs are pressuring employers across all industries. And think
Yeah,
about this, Sri. They're doing so much to improve efficiencies in manufacturing, supply chain, quality,
yeah,
timeliness. But all of these efficiencies are sort of robbed away or stolen, or there is leakage because of healthcare inefficiencies experienced by these very same industries,
yeah.
right? And we're talking billions in just out of pocket costs that are being borne by employees. Loss of
Fantastic.
productivity, increase in absenteeism, workers' compensation claims costs, high cost drug utilization. This is a huge drain for employers today.
Wow, the numbers are certainly staggering, Mahesh, and I think you've shed some great light on them. It's actually remarkable.
Yeah,
You know, as you look at the space, and we look at remote monitoring and a lot of these early detection technologies like Vironix, how do you see them getting adopted, and how do you see
mhm.
these types of things penetrating the marketplace over the next few years?
Absolutely. Yeah, great question. So employers, given all I've said before about the pressures that they're facing, they are increasingly exploring ways to solve for this issue, right? They want to provide employees with more tools so that the employees feel more empowered to take control of their health, right? And like we talked about payers initially, employers are expecting more from these payers, and they're asking for innovative health benefit plans that are more employee centric.
Yeah,
So the benefit of a solution like Vironix that encourages proactive management of chronic health conditions is critical. right? Because they allow employees, Vironix solution allows employees through a very simple, easy to use interface that can be made available on devices like wearables, tablets, phones. It helps employees take better charge of their own conditions, right? So what I would see, or what I foresee, is employers will want to make a Vironix solution a part of the benefits that they provide employees. And in return for using a Vironix type solution, employers can offer incentives, right? Offer them discounts to healthcare subscriptions in terms of gym memberships,
Yeah.
discounts on healthcare premiums, discounts on wearables,
Yeah.
nutritional programs, mental health resources. All
Yeah.
of these things will differentiate the employer, make them more sought after, improve loyalty and engagement.
Wow, that's actually remarkable. I think it's a different way of thinking about employee benefits, and at least in my
Yeah,
mind, I mean, you think about benefits. It looks like your health, your employees' health is a huge benefit as well to your bottom line
absolutely.
and to customer satisfaction and all of that. So that's fantastic insight, Mahesh. Mahesh, one more thing. You've been through the grind, man. You've built a company. I mean, you've grown with Truven, which is a recognized leader in analytics, and you were part of the company's growth. As that company evolved before the sale to IBM Watson. You know, your experiences there. Obviously, you've had a ton of experiences. They've shaped your current feelings, in terms of what you think about the market and the way digital technologies are penetrating this space. So any comments around some of your learnings and experiences in that space, and how they apply to growing companies like Vironix in the digital health space?
Sure, happy to answer that. That's a very interesting, insightful question, really, and thank you for all of the positive comments on my experience and the growth of Truven, especially. Um, I think the time three is really ripe for the adoption of tools like early detection, remote monitoring that Veronix provides, and especially felt now during the times of this current pandemic. Right, a few years ago, I'd be very honest in saying that such technologies using AI in healthcare was met with some healthy dose of skepticism and also a lack of trust, right?
Yeah.
Especially with all of the HIPAA privacy concerns, everyone was wondering, how are you going to secure my patient's information? That's so critically important for us to play in this space, right? But I think with the advent of these technologies and the increasing pressure on the ecosystem because of the need for us to take better care of our health, I think even technology companies have really amped up their provisioning of secure services that can meet the needs of a demanding, highly regulated environment such as healthcare,
Yeah.
right? So I think in today's world, and it's always been true that we had to protect the safety and the security of our health information. We have to protect our frontline health workers. It's always been a good thing. But imagine if you had the use of digital health technologies that could prevent unnecessary trips to the hospital systems.
Yeah.
Then you could even reduce the spread of even infections if you really knew what your conditions were. And that in fact also helps reduce the burden on the healthcare system, right? So all of these things I think has been accelerated recently with the pandemic. I'd say a 5-year leap ahead has happened in terms of the adoption of these technologies. And with the advocacy you're seeing from the CDC, from the WHO, I think it's brought into focus innovative companies such as Vironix.